Step into a doctor's office with me for just 1 minute. The clock is ticking, the waiting room is full, and the average appointment lasts barely 12 minutes. In that tiny window, the way an older woman speaks can decide everything. Say it too softly, the symptom is dismissed. Apologize too much, the urgency disappears. Hide something out of embarrassment, and the disease keeps growing in silence. This isn't just miscommunication, it's a crisis. Here's something shocking. Older women are 30% less likely to be taken seriously when they speak at medical appointments compared to men of the same age. That's not opinion, it's data. Research shows that nearly half of senior women leave appointments without getting the tests or answers they actually need. And the ugliest part, most never even realize it until it's too late. Today, I'm pulling back the curtain on the 8 shocking truths about how older women speak at medical appointments, truths that no one talks about, but every senior deserves to know. And when we reach number 4, you'll see why it's the single most dangerous habit keeping doctors blind to life-threatening problems. All the science I've shared has trusted sources. Check the description for every reference so you can see the proof with your own eyes. But before we dive in, here's a quick question. How old are you? I love seeing women from every corner of the world share their stories here. And yes, I personally jump into the comments every day to reply, so don't hold back. Now, without any further ado, let's start with number 8 in our countdown. And it's one you'll probably recognize in yourself. Number 8, using polite, soft language gets dismissed. It feels natural to be polite, especially for women raised in a generation that valued modesty and respect. But research shows this politeness can backfire in the exam room. A 2019 analysis in patient education and counseling found that patients who used softer, less assertive language were 22% less likely to receive follow-up testing compared to those who spoke firmly and directly. For older women, that can mean serious symptoms get brushed off as not urgent. Elaine, a 72-year-old retired librarian, once told her doctor, "It's probably nothing, but I've been feeling a bit tired." Her words were brushed aside. Months later, tests revealed she had advanced anemia. She had downplayed her fatigue, and the doctor matched her tone, casual and dismissive. The science is clear. When language is soft and apologetic, doctors unconsciously perceive symptoms as less severe. Politeness makes sense in everyday life. It keeps the peace at dinner tables and in conversations with neighbors. But in a medical office, it can strip urgency from what may be a life-threatening issue. Fatigue, chest discomfort, swelling in the legs, phrases like, "It's probably nothing," or "I don't want to bother you" make these red flags sound like background noise. Older women aren't weak. They're polite. But in medicine, politeness sometimes costs them real care. If your voice sounds uncertain, your body might be screaming while your words whisper. And that whisper can get lost. That's the ugly truth, and it leads us straight to the next one, which digs even deeper into how describing pain the wrong way changes everything. Number 7, talking indirectly. One of the ugliest truths about medical appointments is that older women often speak indirectly when describing their health concerns. Instead of saying, "Doctor, I can't walk across the room without losing my breath," it comes out as, "Well, sometimes I get a little tired, but it's probably just age." That softer, less direct style of communication can be devastating because studies show doctors are far less likely to order tests or pursue aggressive treatment if symptoms are downplayed. A 2018 analysis in patient education and counseling found that patients who spoke indirectly were 40% more likely to leave an appointment without a clear diagnosis compared to those who used specific, direct statements. Take the story of Gloria, a 72-year-old widow. She went to her doctor complaining, in her words, of just little chest flutters. Nothing serious. Her doctor brushed it off as anxiety and sent her home. But 2 weeks later, she was rushed to the ER with a minor heart attack. When she reflected, she admitted, "If I had said, 'Doctor, my chest hurts every morning,' maybe they would have looked closer." That hesitation, born out of politeness or fear of being a burden, almost cost her life. Here's the painful reality. Indirect language makes serious problems sound optional. Doctors hear little discomfort instead of possible heart disease. They hear just a bit of trouble walking instead of early mobility loss. And because appointment times are short, once the conversation drifts away, it rarely comes back. For older women who are already at risk of being dismissed, indirect talking becomes a dangerous trap. The solution is not about being rude. It's about being clear, direct, and unapologetic. Saying, "I have chest pain" daily forces attention. Saying, "My legs hurt so much I can't climb stairs," leaves no room for dismissal. Doctors respond to precision, not politeness, and that leads us to the next ugly truth. Even when women speak clearly, using apologetic language, constantly saying sorry or downplaying concerns can undo everything and push their needs right back into the shadows. Number 6, downplaying pain. One of the most dangerous habits older women bring into the doctor's office is downplaying their pain. Instead of saying, "This pain wakes me up at night and makes it impossible to walk," they'll say, "Oh, it's not too bad, just a little ache now and then." That single choice of words can mean the difference between a doctor ordering a scan or dismissing the concern entirely. Research backs this up. A 2017 study in the Journal of Pain found that women who minimized their pain were twice as likely to leave with nothing more than reassurance, while men describing the same symptoms received further testing. Take Evelyn, a 74-year-old grandmother. She had persistent hip pain that made her limp, but when she spoke to her doctor, she brushed it off as just old age. No tests were ordered. Months later, the pain became unbearable, and only then did an MRI reveal advanced arthritis that could have been treated much earlier. Evelyn later admitted, "I thought if I didn't make a big deal about it, I'd look stronger. But staying quiet cost me months of mobility." The truth is, downplaying pain creates a dangerous illusion, an illusion that the body isn't screaming for help when it actually is. Doctors already work under time pressure, and when symptoms are softened, it makes it far too easy for them to move on. For older women, this becomes a trap. The quieter the complaint, the longer the suffering continues, and the worse the condition grows. The solution is courage, stating pain in clear, measurable terms. Say, "My knee pain is an 8 out of 10 and it keeps me from sleeping." Say, "The pain is constant and it's getting worse every week." Precision forces the tension. Vagueness invites dismissal. And that leads directly to the next ugly truth. Even when pain is clearly described, if an older woman accepts interruptions during her appointment, her story is cut short, and crinkled details never make it to her chart. Number 5, over-apologizing for wasting time. One of the ugliest habits I see in medical appointments is how often older women apologize for even being there. They start sentences with, "I'm sorry to bother you," or "I know you're busy," before they've even explained their symptoms. What they don't realize is that this constant apologizing plants a seed in the doctor's mind. If the patient believes their issue is minor, maybe it isn't urgent at all. A 2019 review in Social Science and Medicine noted that women were significantly more likely than men to use apologetic or deferential language in healthcare settings, and their concerns were 30% more likely to be labeled as non-serious. Take Ruth, a 76-year-old retired school teacher. She had weeks of chest tightness but opened her appointment by saying, "Sorry to take up your time. It's probably nothing." The doctor rushed through the visit, ordered no tests, and sent her home. Days later, Ruth was admitted to the hospital with a mild heart attack. She told me later, "If I hadn't apologized, maybe they would have looked at me differently." That one habit nearly cost her life. Here's the harsh truth. When seniors frame their presence as a burden, doctors unconsciously downgrade the urgency of their complaints. It's not that doctors don't care. It's that time pressure forces them to prioritize, and an apologetic tone signal, "This can wait." For older women already battling stereotypes of being too emotional or too worried, over-apologizing magnifies the risk of being ignored. The solution? Replace apology with assertion. Instead of saying, "I'm sorry to bother you," say, "I need your help with a serious problem." Instead of shrinking back, stand firm. Your health is never a waste of time. And that brings us to the next ugly truth. Even when women do speak up, accepting interruptions during the appointment can rob them of the chance to fully explain what's happening to their bodies. Number 4, talking too long without focus. Another ugly truth is that many older women talk too long without getting to the point during medical appointments. It usually comes from nerves or from a lifetime of being polite and trying to give context. But in a world where most doctors spend less than 12 minutes per patient on average, according to a 2020 BMJ Open study, wandering stories can mean the most important detail never gets heard. Doctors may tune out, assume the issue is less serious, or miss the critical symptom altogether. Consider Helen, a 79-year-old grandmother who came to her appointment complaining of just feeling off. She spent 10 minutes talking about her daily routine, her sleep patterns, and her diet before she finally mentioned that she had been having sudden dizzy spells. By then, her doctor's attention had shifted, and she walked out with nothing but vague advice. 2 weeks later, she collapsed from an undiagnosed heart rhythm problem. Helen told me afterward, "If I just said, 'Doctor, I get dizzy every day,' maybe things would have been different." The danger is real. Talking too long without focus allows life-threatening symptoms to get buried in small talk. For older women who already face a higher risk of dismissal, long, unfocused explanations can backfire, making it easy for doctors to minimize the urgency of what they're hearing. The fix is simple but powerful. Lead with the problem. Start with the hardest fact: I have chest pain every morning, or I can't climb stairs without gasping. Then explain the details if there's time. By front-loading the key symptom, you ensure that even in a rushed appointment, the doctor knows what matters most. And this takes us directly to the next ugly truth. Sometimes, even when older women speak clearly, they sabotage themselves by using soft or hesitant voices, which makes doctors underestimate the seriousness of what's being said. Before we go on, if you're getting value from this video, go ahead and tap that like button, and make sure to subscribe and turn on the bell icon so you never miss out on powerful health tips like these. Number 3, using family members to speak for them. One of the ugliest patterns I've witnessed is when older women let their family members speak for them during medical appointments. It may come from love, daughters, sons, or spouses trying to help, but it can unintentionally erase the patient's own voice. When a doctor hears the story secondhand, they don't get the full picture. The tone of pain, the choice of words, the emotions that show how serious the problem really is. A 2016 report in Health Communication found that when family members dominated the conversation, doctors were 25% less likely to ask follow-up questions directly to the patient. That means key details are missed, and symptoms can be underestimated. Take Lorraine, a 75-year-old woman who came in with her daughter. When the doctor asked what was wrong, the daughter jumped in. She's just been tired, nothing unusual, just old age. Lorraine sat quietly, nodding even though she had been battling chest tightness for weeks. The appointment ended quickly. A month later, Lorraine was admitted to the hospital with severe coronary artery disease that could have been caught earlier if she had spoken for herself. She later told me, "I didn't want to contradict my daughter, but I wish I had found my own voice." Here's a harsh truth. When older women hand their voice to someone else, they lose credibility in the doctor's eyes. It makes the symptoms seem less urgent, as if the problem doesn't even belong to the patient. Doctors are trained to listen directly to the person in pain, and when that voice is muted, the urgency fades. The solution is courage. Family can sit in for support, but the patient must speak first in her own words. A daughter can add details afterward, but only after the doctor has heard the truth directly from the woman herself. And that leads us into the next ugly truth. Even when older women do speak for themselves, many make the mistake of smiling through their symptoms, masking pain with politeness, which convinces doctors that everything is fine when it isn't. Number 2, forgetting medications and supplements list. Another ugly truth about medical appointments is how often older women forget to bring a complete list of their medications and supplements. It seems small, but it can completely change the outcome of the visit. Without this information, doctors are left guessing about possible drug interactions, dosage conflicts, or side effects that might explain the very symptoms being discussed. According to the CDC, nearly 40% of adults over 65 take 5 or more prescription medications, and when supplements are added, that number climbs even higher. Yet studies show that more than 1 in 3 seniors fail to report at least one supplement or over-the-counter drug to their doctor. The result? Dangerous gaps in care. Consider Maria, a 78-year-old who came into her appointment with worsening fatigue. She mentioned her blood pressure pills, but forgot to mention the daily ginseng and fish oil she was also taking. Her doctor dismissed the fatigue as age-related. Weeks later, Maria collapsed from a bleeding ulcer. The fish oil, combined with her prescribed blood thinner, had made her condition far worse. Looking back, Maria admitted, "I thought supplements didn't count. I never imagined they could nearly kill me." The danger is obvious. Forgetting medications or supplements hides the real picture. Doctors can misdiagnose, overprescribe, or miss life-threatening interactions simply because they don't know what's really in the body. And the truth is, it's not always the doctor's fault. If the information isn't shared, the right care can't happen. The fix is simple but life-saving. Write down every pill, every vitamin, every supplement, no matter how harmless it seems, and bring it to every appointment. A clear list is as important as the symptoms themselves because it tells a full story of your health. And that takes us straight into the number 1 ugliest truth. Even when older women have their list, their story, and their symptoms ready, many still smile through their pain, masking the seriousness of their condition behind politeness, which can convince even the best doctor that nothing is wrong. Number 1, hiding embarrassing symptoms. The ugliest truth of all is this: older women often hide embarrassing symptoms from their doctors, and it can cost them their lives. Things like urinary leaks, bowel changes, vaginal bleeding, or memory lapses get brushed aside because they feel too personal, too shameful, or not worth mentioning. But here's the reality: these are often the exact red flags that point to serious disease. A 2019 study in the Journal of Women's Health found that women over 65 were twice as likely as men to withhold potentially serious symptoms out of embarrassment, leading to delays in diagnosis and worse health outcomes. I'll never forget Jean, a 74-year-old who came to me only for routine fatigue. After a long pause, she finally whispered that she had been bleeding for months but hadn't told anyone, not even her family, because she felt ashamed. That hidden detail turned out to be endometrial cancer, caught dangerously late. She told me through tears, "I thought if I ignored it, maybe it would just go away." But ignoring symptoms doesn't make them vanish, it makes them deadly. The truth is, no symptom is too small or too shameful to share. Urinary leaks can signal early nerve issues. Digestive changes can reveal cancers. Sexual health problems can uncover hormonal imbalances or more. By hiding these symptoms, older women are unknowingly giving disease the time it needs to grow. Doctors can only treat what they know. Silence doesn't protect. It endangers. The fix is courage and honesty. No matter how uncomfortable it feels, say it out loud. A good doctor has heard everything before, and your honesty could save your life. So now you know the truth. These 8 hidden habits, talking indirectly, downplaying pain, over-apologizing, letting others speak for you, forgetting medications, and even hiding embarrassing symptoms, are not just quirks. They're silent traps that can cost older women their health, their independence, and sometimes their lives. But here's the power you hold. Every one of these truths can be changed starting today. Speak directly. Be specific. Bring your list. Share everything, even what feels uncomfortable. Your voice is the most important tool in any medical appointment, and when you use it with confidence, doctors have no choice but to listen. Every reference I've used is linked in the description below, because I want you to see the science yourself, not just take my word for it. Now, let me ask you, how old are you, and what's one habit you've noticed in yourself at the doctor's office? Do you downplay symptoms or stay quiet out of politeness? Share it in the comments. I read and reply to every single one because your story matters and it could help another woman watching right now. If this video opened your eyes, give it a like so more women can find it. Share it with a friend or family member who needs this message. And don't forget to subscribe because the next video could be the one that saves your health. Tell us what you think in the comments below, and don't forget to let us know your experiences too. Thanks for watching.